Dr. Salim Masoud. I'm a pulmonologist, chest physician, and today with Ponea Healthcare, we want to discuss COVID. What is COVID-19? So COVID-19 is a viral infection which started in 2019, December 2019, and it has become a pandemic, started from China and affected the whole world. And what is the relationship between pneumonia and COVID-19? So COVID-19 is caused by a virus called SARS-CoV-19. So this is a virus, and there are many other viruses, and the viruses are part of microorganisms, and there are also other groups of microorganisms like bacteria and fungus. So when a bacteria, virus, or a fungus invade your tissue, either the ear, the nose, the lung, the bone, then they cause an infection. And this infection, for example, if it affects your throat, we call it pharyngitis. If it goes to your lungs, we call it pneumonia. So COVID-19 affects the airways. So it goes through the nose and starts causing an infection there. It causes an infection in the nose and the throat. But for a few patients, this infection extends down into the lung. And when it gets to the lung, then it causes COVID pneumonia. So that's the relationship. So COVID is just one of the many microorganisms that can. What is the relationship between COVID and asthma? So initially, people thought because asthma is a disease of the airway, and COVID also affects the airways, so people who are asthmatic will be at a higher risk of getting COVID. And if asthmatic patients get COVID, then they are at higher risk of getting a severe COVID. And for those who are asthmatic, then they may be at a higher risk of dying from COVID. Unfortunately, or fortunately, this relationship has not been established. So for patients with well-controlled asthma, then the risk of them getting COVID is the same as the people who don't have asthma. And for the asthmatic patients who have their asthma is well controlled, the risk of them getting severe asthma is the same as the patients who do not have asthma. So there have been very little association in terms of how the frequency at which asthmatic patients get COVID, as well as how severe their COVID becomes. What is the effect of this virus on the respiratory system? So COVID is primarily a respiratory tract infection. So it affects primarily the respiratory tract. So for majority of people, it just affects the upper airway, the nose, throat, and the nose, throat. And for majority of patients, and a few patients will get pneumonia as a result. And it's also been shown that COVID is not just, it doesn't just cause problems in the respiratory system. It also has a multi-system effect. So it can affect the brain, can affect the kidneys, and affect literally any other part of the body. But in terms of the respiratory system, for many people, majority of patients, the effect is transient or is not permanent. So they get sick briefly, like transient respiratory viral infection. They get sick and then they recover fully without any complications or damage. But for a few people, especially those who get pneumonia, they may require admission, and for the people who require admission, some of them may require to be taken to ICU. And the majority of patients who get COVID recover fully, but a few will have long-term complications. So for these complications, basically, the symptoms, respiratory symptoms, for example, the commonest being a cough. So they have a persistent cough, and a few people will have scar tissues in the lungs as a result, but and a few people may not recover from these scars and these complications, and those are the ones who die. But for those who survive, they may survive with scar tissues, and we are keeping on monitoring these scars and see how they recover completely. So basically, majority people don't have any long-term effects on their respiratory system. A few people will have pneumonias, requires support in terms of oxygen or ventilator, and a few people will recover with scars, and few people will die because the damage is too much. The damage is not compatible with life. What is post-COVID respiratory rehabilitation? So, like I said, many people recover fully. So for those who recover with one or two complications, then they can go through rehabilitative sessions to at least help them with breathing exercises, with breathing maneuvers, and try and help them rehabilitate themselves. So basically, it's not for everybody. Rehabilitation is not for everybody. It's for those people who probably had severe COVID, who were admitted in ICU or in the ward, and they had very severe breathing problems. So the rehabilitation services to help them with the breathing exercises and try and help them breathe better. There are new advances in the respiratory treatment for COVID patients. So COVID is a new disease, and there's a lot of ongoing research in terms of medications. And yes, there are so many medications in the pipeline awaiting approval. Some of them are in different stages of research, and we are hoping the more and more medicines will come out. So for COVID, there have been many medicines tried. Some have proven not to be effective, and they were discontinued. And there are some which are still continued, but and there are more coming out. So the research in COVID is very active, and it's an ongoing research. So we have many medications which are in the pipeline. Some of them are in late stages, some of them in the somewhat middle stages of development. Yes, so I want to thank you for listening to these sessions with Ponea Healthcare. And if there's any more inquiries, any more information necessary, we can always provide. You can book our clinic or our services through Ponea Healthcare platform, and then we can connect and discuss more. We're looking forward to more sessions like this one, and trying to educate patients and inform them of what is available in terms of respiratory health care. Thank you very much, and have a good day.